First thing I want to say is that the financial closures is if this was a drug conference, I would have to say I'm employed by this drug company, and you would have to take whatever I have to say with a certain grain of salt. So my financial disclosure is I am an owner of Eagle Tree Herbs. I make and sell herbal products. And much the same way as if you go to a naturopath and the naturopath says, oh, you should take this, this, and this, and by the way, here it is. And they sell it. That I always have a little bit of an issue with that, which is one of the reasons why I want to get out of the herbal products business. Standing Rock spoiled me forever. I love giving away stuff. And I really want to focus on the educational piece and the nonprofit piece. But I don't charge people to see them, but I do charge people. So it's hard, when you because you tend to recommend what you have. So you have to be really careful about that. So one of the herbs I'm going to be talking about later is kratom, and I sell that. So I just want to be really clear that, anytime and whenever you're researching herbs on the internet, really carefully look at who is benefiting financially, what affiliate links, what things are being sold. This whole thing is promoting a particular product. Is somebody profiting by it? So I'll just say out front, I'm profiting in some way, or my business could potentially profit from the materials that I'm going to talk about. So why herbal pain relief? Obviously, there is a U.S. drug epidemic. I'm not going to go over the statistics. Everybody knows there is a huge opiate epidemic. It's a huge profits for big pharma. Herbs are cheap. You can grow them. They're free. And even if you can't grow them, you can make your own herbal extracts for, super cheap. And herbs address causes, not just symptoms. And herbal medicine both educate and empower people. But, when we talk about the opiate epidemic, and that's what everybody's really talking about now is the opiate epidemic. Nobody really talks about, there's a pain epidemic. Nobody's really talking about that. And that's something that I think we really need to talk about as well. So I'm going to go over fairly quickly because I put this together for my students, and some of you who are already practitioners may know some of this stuff, but some people who are just starting may not. So the mechanisms of normal pain is the perception of nociception, which is the activity of peripheral pain pathways. I'm just going to kind of briefly go over that nociceptive pain results from an acute injury or infection of normal tissues that usually resolves, and inflammatory pain is associated with tissue damage or active inflammation that operates in the hours, days, or months after tissue damage. And that's a kind of an important distinction to know. And there's 4 basic steps of pain transmission. I'm just going to go over them kind of briefly as transduction, transmission, modulation, and perception. I'm not going to go too much into all of these clinical details, but if you don't know some of this stuff, you should study it. If you are in chronic pain or recommend things for people in pain. So the types of pain. There is acute pain, which is the general sudden onset with an obvious identifiable cause, like injury, disease, or iatrogenic, which is doctor-caused, like surgery. It's usually of a short duration, less than a month. It's is an intensity that's generally variable and indicative of the severity of the condition. And it's usually accompanied by characteristic behavior, rubbing, moaning, crying, screaming, whatever. Chronic pain is persistent. It's longer than a month. So it's usually the result of a chronic disease or a condition. It may have no obvious cause. There's prolonged functional impairment, both physical and psychological. It may be associated with insomnia, irritability, and even depression. And it's much more difficult to manage chronic pain than acute pain. So the basic pain characteristics, we all know the scale of 1 to 10. Of 1 pain, no pain, and 10 the worst pain imaginable. The location, the quality, and the factors that alleviate or worsen it, such as activity, positions, hot, cold, various treatments. And this is really important as practitioners or even community health workers or people that, talking to you about what kind of pain comes up. Because if you're an herbalist, oftentimes somebody says, what's wrong with you? And you think, oh, what herb? Like, for example, I had somebody at Standing Rock that came in and said they were having a horrible stomach pain, and I had somebody run up and was trying to make him a cup of ginger tea, not really asking him a simple question: what was your pain level on a level of 1 to 10? Where was it? How long has it been? What other kinds of signs and symptoms? And, it's spending, 2 minutes answering these questions, I realized that this was a gentleman that was appearing with symptoms of an acute appendicitis, who had a life-threatening condition, and it was very challenging to get somebody out of that area to the hospital in time. It could have, had a bad outcome, which didn't, fortunately, but he could have sat in, around a bunch of loving people who were making him lots of tea, and, doing Reiki on him and, giving him, lots of stuff, and not one person saying, oh, what's your pain scale on a scale of 1 to 10? How long have you had it? Are you doing anything that makes it better? Simple, easy questions. So there's a PQRST method for pain management. One thing I love about in medicine is all the different, not acronyms, what do they call them? Mnemonics. Mnemonics is the word. So P is provokes, what causes the pain, what makes it better, what makes it worse, the quality, what does it feel like, is it sharp, dull, stabbing, burning, crushing. Let them describe the pain and try not to leading questions. Where does it radiate? Is it in one place? Does it go anywhere else? Does it start somewhere and is now localized to one spot? The severity and the time. When did it start? How long did it last? So in those previous kinds of questions, if you think, PQRST, if you can think of those are the kinds of questions that you want to ask, because you want to be able to know, is this something that is going to be, within your scope of care to be able to treat or evaluate, or is this person going to need some additional referral? So some other questions that you want to ask. Remember that pain is a sign there's a problem. Nobody's in pain, whether it's acute or chronic, and they're fine. They got a problem, which is why we're dealing with it. So you want to be able to, before you come up with a solution to the problem, evaluate what the problem is. So, ask them if they're on any medications or allergies. And, maybe if it's not in your scope of practice, you might not know much about the medications. That's okay, but, it may be more information is helpful. Does it hurt on a deep inspiration? Is there an activity that makes it worse? When I get up and walk around, my ankles hurt worse. Is it, that kind of thing? Is it the same? Is it different? Do you have a family history of heart disease, lung problems, stroke, or hypertension? You also want to check somebody's level of consciousness, if they're like really out of it. Is their pupils reactive? They may be complaining of pain and have something else going on, like a drug reaction, or they may be having a stroke. You just, you need to be able to have a little bit of knowledge. And is there any recent trauma? So just some stuff about chronic pain. Chronic pain can be both debilitating and life-altering. It can cause weight gain, loss of mobility, and an increase in inflammation. It's linked to a 3 times greater incidence of depression and mood disorders. And it creates general health issues from a loss of movement and exercise. Good news is it can be treated successfully using herbs and holistic methods. And one of the things I didn't mention is why I've kind of done a specialization in pain management is I was in a car accident a number of years ago and I broke both my legs, and I'm allergic to codeine. And I had actually recently lost a bunch of weight from weight loss surgery, and then I had a heart issue, and that's how I got in my car accident. And then the weight came back up, so that doesn't help my pain level. So, I've been doing a lot of personal research, and this is a personal journey for me. And one of the things that happened is that I started gardening as part of my rehab. And I tend to not do things unless I'm going to really go into it. So I started learning about permaculture, and I decided to take my little tiny herb business and make it a little bit bigger business. And my interns come and help me. And so, sometimes good things happen out of these things. But anyway, moving on. See, I tell you, I get easily distracted. So pain is both a sign and a symptom. Pain is your body saying something is wrong. There is acute, which means a sudden onset of severe pain greater than a 7 on a standard pain scale, warrants medical attention and can be life-threatening. I just want to say that again. If somebody says, and sometimes people can overreact, but if somebody is having a pain scale of 8, 7, 8, or 9, there's something wrong. As that means multiple levels of investigation, which probably, you're not really capable of on your own. You may need to get some other advice and a team of people. It may need a hospitalization. It may not need a hospitalization. But I wouldn't personally recommend anybody dealing with somebody with that high of a pain level on their own without additional help.
I just wanted to add something on the pain scale. My PT told me that women usually underestimate their pain level on that scale, and to think about it.
Oh, that's interesting. I'll repeat that for the mic that Claire mentioned that she was told by her physical therapist that women tend to underestimate that level of pain scale, and that may be true. Women certainly, have the experience of childbirth, so that may affect that. So chronic pain that's unresolved for more than a few weeks also warrants further investigation. Whether that investigation may be, may not necessarily be medical intervention, but it definitely warrants additional investigation. But I do want to say we don't want to put off having medical attention, that knowledge is power. And sometimes we get so locked into Western medicine bad, herbs good, that we forget that there is this great body of knowledge and expertise and really caring people out there there's just a real growing movement towards, particularly the younger physicians, to be really open to alternatives. So I really want to encourage people as healthcare workers to really think about working as a team and knowing that certain people have certain levels of skills. Like if you want to know something about chronic pain, talk to me. But if you want to talk about a whole lot of other herbalists, talk to Sue, or talk to, there's a lot of other things that a lot of other people know. So I want to talk about the benefits of herbs for pain relief. So drugs have side effects. They really do. I mean, the reason why I'm allergic to opiates is not only they make me feel nauseous, but they make me just feel terrible. I don't understand why people take them as a recreational thing, because I feel like horrible if I ever have to take any of those. And there's constipation. There's all kinds of horrible side effects with most drugs that are used particularly for chronic pain. In addition, herbs have additional benefits. Like a lot of herbs have antioxidants, and they also they're studied for preventing cancers and other kinds of serious health issues. The anti-inflammatories, again, what's the cause of most pain is inflammation. All those anti-inflammatories are going to make a huge difference. Aspirin, if you are going to take an NSAID for pain, aspirin has gotten a bad rap because a very small amount of people have stomach reactions to it, but it's relatively, it's a relatively organic compound. It has long-term, it's been studied long-term and has, heart benefits. So if you're going to have to take something in a pill form, of course, I go to the meadowsweet and white willow, but if that doesn't work, aspirin. I don't think there's anything wrong with aspirin, personally. And this is, I'm going to talk a little bit more about this at the end, but this is super important, is you want to combine them with physical methods. That just taking an herb for pain is like just taking a drug for pain, particularly for chronic pain. You're not going to get the same results. You really need to combine it with physical methods like massage, hydrotherapy, any of the holistic health modalities that you're using, whether it's mindfulness or movement therapies or that whole barrage of energy work, any of those healing methods that work for people. So again, you want to have herbs to treat causes, not symptoms. So there's a type of analgesic, means without pain. So there's a type of herbal analgesic. And those are, they come in a couple of categories: anti-inflammatories, anesthetics, antispasmodics, nervines and sedatives, opiates, psychotropics, and healing herbs that are for joint and tissue repair or vasoconstrictor dilators or edema reducers. We're going to go into some examples of each herbs that go into that category. So I like to put together a good pain formula, which is got an anti-inflammatory. You need to be able to work on that inflammation. A nervine, an antispasmodic, and an opiate analog, something that affects those opiate receptors in the brain. Those are the ideal pain formulas.
What's a nervine?
A nervine is like a sedative that it specifically affects the nerves, like skullcap is a nervine. So musculoskeletal healing herbs are ones that increase joint lubrication, promote muscle and bone healing. This is not a comprehensive list. There'll be lots of your favorite herbs that are not on here. These are either my favorite herbs or herbs that I'm familiar with, but there's lots of other ones. So arnica, black cohosh, comfrey. Comfrey gets a bad rap. I'm a fan of comfrey. I can have a discussion later on about comfrey. Horsetail, mullein. Interestingly enough, mullein root is actually one of the ones for joint lubrication as opposed to mullein leaf. You think of mullein as your cough herb, but it's really got some properties for those joints. Solomon seal is the kind of the standard one that if you ask most herbalists, they're going to recommend Solomon seal, and also teasel. So here's some anti-inflammatories. Of course, we think of arnica, and arnica is external only. Ashwagandha, boswellia, calendula, cat's claw, devil's claw, garlic, ginger, holy basil, feverfew, licorice, parsley, nettles, turmeric, and the willow bark and other salicin-containing herbs, which are the aspirin-type herbs. Wintergreen, aspen, birch, meadowsweet. Actually, meadowsweet, I think, is supposed to be even stronger than willow. And then there's anesthetics, and they apply directly on the nerves. Cayenne is on there, and some people put cayenne on wounds, which I am like, why? It will hurt. But it's out there, it's been in use. Cocoa leaves, which of course we can't get in this country. Clove, which is easy to get. Curare, which is also, I don't think you can really get, but I threw it out there because I thought it was pretty fascinating. Wintergreen, which is one of the things I use quite a lot. It's in my green leaf formula, and I'm a super big fan of wintergreen. Electric daisy and black pepper. And then you're probably familiar with the thing about turmeric works better with black pepper, so you want to combine the two whenever, because it works better together. I don't know the botanical names of hardly anything. So there's not. Okay, yeah. So I'm really bad with, which is one of the reasons why I don't call myself an herbalist. I'm a medicine maker. I was a midwife for most of my career, so that's more of my background. Antispasmodics are smooth muscle relaxants, and they've also been described as nervines. So there's some overlap between nervines and antispasmodics, or sedatives, or hypnotics. So those herbs, and then some of the older books list things. There's like some newer modern terms that people are starting to use, where you'll hear some kind of more old-fashioned terminology for some of these things. So we've got angelica, black and blue cohoshas, black hawk, chamomile, cinnamon. Stupid computer. Sorry about that. Hawthorn berry, fennel, kava kava, Jamaican dogwood, and lobelia. Did you have a clarifying question?
Yeah, I was just wondering which type of angelica.
I'm a fan of any of the angelicas. There's a couple of different kinds, and there's even the Chinese dong quai. So, I use the ones that grow in my garden, but, there's a variety of them, and I'm pretty happy with using any of them. And some of the other naturopaths or doctors might be able to address that a little bit better. I did want to point out something about Jamaican dogwood, though, because that's one of my favorites, and it's in my formula. So have you all heard the story of the native people who would throw leaves of a plant in a pool of still water, and the fish would get paralyzed and come to the surface, and they would gather them up? You've all heard this story? That's Jamaican dogwood. So Jamaican dogwood really is a very effective antispasmodic. We'll put fish out.
Do you know where it's from?
Florida, I think. Well, I know that the native people in the Seminoles. I know it was used by the Seminoles, which are in the Florida area, but I think it's all through all those tribes in the South. So there's a long list of herbal sedatives and nervines. I don't know if I'm going to go through saying every single one of them, but I think most people are familiar with most of them. I'll just hit a couple of and some things are in both. Like Jamaican dogwood is both an antispasmodic and a nervine. Hawthorn is both an antispasmodic and a nervine. So if you're making formulas, if you can catch them with both, those are all really good. Skullcap, valerian, wild lettuce. There's a lot of stuff going on about wild lettuce, and a lot of times it's it's just a really a wonderful herb, and it's really easy to grow, and it grows wild all over. And it's not in my current pain formula because I was out of it, but that happens with mine. They change a little bit depending on what's in my garden at that very moment, but the next one will have it in there. So opiate analogs these are herbs that bind to the same receptors, GABA, in the brain as opiates. But they can also be used to reduce opiate addiction. So ashwagandha, black cohosh, California poppy, the cordelias, I don't even know how to say those. I don't really use them. I'm not a big Chinese medicine person, but devil's claw, kava kava, kratom, milky oak, that is actual papaver, that is actually opium. So it's not really an analog. That is opium. And you can, get the opium, and you can grow it. You can grow it in your garden. You just can't legally process it for extraction. St. John's wort. And St. John's wort, there's a lot of really amazing research on St. John's wort. I don't have all the research at but there is the recent Herbalism Guild. There was somebody who did an entire workshop just on the effectiveness of St. John's wort alone to get people off of opiates. And also because it's something that's also used for depression, I was really impressed with how effective St. John's wort can be for as an opiate analog.
Daphne,
Yeah.
is the St. John's wort the cultivar or the wild plant?
The wild plant mostly, but you can cultivate it. There's a St. John's wort that's kind of, that you get in the nursery, that's
What
the,
I'm talking about.
Heron, were you going to answer that one?
Yeah, I was just gonna say the St. John's wort in the garden that has the big yellow flowers is not used that way.
Right. The one that you buy in the nursery stores isn't.
Okay.
But you can grow the wild one
The
in
wild
your
one's a weedy.
weedy. Yeah, you can grow the weedy
Grow
one.
without trying.
Yeah.
Yeah.
So psychotropics, cannabis. I have one slide. I'm going to talk really, really briefly about cannabis because lots and lots of people say lots and lots of stuff about it, and you could spend a whole hour just on that. California poppy. Now, California poppy, even though it's got the name poppy and it is a poppy, is not related to an opiate. It does not give you a positive on an opiate on a test. It's a mild sedative. It's does a lot of the same things in your brain, but it is not related to opium. Kava kava, kana. In Thailand, they pronounce it kratom. We call it kratom or kratom. There's a couple of different pronunciations for it. Kratom or kratom. Salvia, devorum, pardiarco, and white lotus. So I'm just going to really talk briefly about cannabis as pain relief. How am I doing on time here? Everybody swears it's the panacea for chronic pain. And for some people, it really does help. Because one of the aspects of pain has to do with tension and relaxation, and cannabis can be a really good tool for that. Another thing is distraction. So cannabis can be a thing that people can, it works well for some people. Other people, it has this really awful side effect. You get stoned, which is great for some people in some parts of their lives, but other people who want to, have jobs or work or do things that they don't want to be, stoned all the time, then it's a side effect it's a not a good side effect. Or maybe they work at a job where they're getting drug tested. Well, that's not kind of a social side effect, though. That's not really a side effect. I'm really in favor. I'm a medical card holder. I use it. I don't find it that helpful for pain myself personally, but I know lots and lots of people who just swear by it. And the new thing is they're almost drugifying cannabis now. They're making all kinds of formulations of this Rick Simpson oil and these extracts, and like when I was growing up in the 70s, the weed was not very strong. And now what you have here is a super hybridization for specific kinds of qualities of a plant that really puts it on the road to drugs. So we really have drugified cannabis. And in some ways that's good, in some ways that's not good. So, we have to kind of look at that. So everybody has a different result on that. Obviously, the new thing now is the high CBDs, which is the higher pain thresholds, and the lower THC levels. So, those higher CBDs are better for pain. What I've really found is these high CBD cannabis oils are really phenomenal for pain for topically. I get a mixed result again for people who have it to take it internally, whether it's tinctures or smoking it or inhaling it or eating it in all of its different forms. It's kind of all over the map, and that's also because it's grown all over the map. But now there's some more and more we're getting hemp seed oil that's really grown real specifically for the high CBD content. I'm putting it in my external formulas, and I'm just a real big fan of external CBD oils for pain, for chronic pain.
I'll make one comment.
Sure.
I know you wanted to word off against me, you were talking. Because one-to-one extracts of THC to CBD, in other words, if it's a tincture, having relatively equal parts of those
Uh-huh.
have been demonstrated in the limited clinical trials that we have. There's some of them were in Brazil to be some of the most effective analgesics. So if you can combine a bit, the CBDs moderate some of the anxiety and psychoactive effects of the THC, and for internal use, I manufactured some of that stuff and was using it with clients, and it was people were getting better resuls.
Oh, absolutely. So I just wanted to repeat the question from you. If there was an equal amount of CBDs to THCs, whether it's an extract form or another form, the research on the pain relief effectiveness was much increased, which is my understanding of it as well. Is that you really need to get the CBDs is where we get our pain relief from, and some people the THC actually is part of it though. Sometimes it's people want to be distracted or in a different mood, or maybe they're anxious and it helps them relax, or it helps them sleep. So you're going to have a little bit of different results, but it's really the CBDs we're going for. Oops. Is that the... So, kratom is, it's a tropical tree. It's a 60-foot tree. It grows all over Southeast Asia. And it's a member of the coffee family. So it's very similar to coffee. It's used as a substitute for opiates, even though it's not derived or related to the opium poppy. And, there's a lot of misinformation and bad stuff going out there about it. Promoted, interestingly enough, 2 weeks after one of the major drug companies got a license for mitragynine. Then the FDA tried to get kratom banned in the US and rated the same as heroin. 2 weeks after the drug company did that, then the FDA started their push. And then out of the blue, the internet sort of blew up, and all of these people, it was a great example of social activism, because what happened is that the FDA was flooded by more people writing in about a potential rule change that they had made, or a potential proposal, than anything they'd ever gotten. 94% of people had positive things, and they were the American Kratom Association got super active, and they did a march on Washington. They found a congressman to promote a bill, and it was stopped. I mean, they were going to make kratom in the same category as heroin with a 30 days notice, and enough people said no, this is not okay, that they stopped it. Now they're talking about it again, so we're not completely out of the woods, and what this is a plant. It's a leaf from a tree. It is not a drug. Now, there are head shops, and you can get into these drugifying of herbs, putting things in capsules, who knows what's in it. There can be some bad stories. But when you look at the plant, the leaf, or an extract that's made by somebody who you really trust, it's a whole different ballgame. So, interestingly enough, as opposed to like the pain formula, like I make a pain formula, a lot of it is sedative herbs. I would take it at night. You don't really want to take it during the day and try to work, because a lot of those herbs are going to be sedating and mellowing herbs. The nice thing about kratom is it's a stimulant. Remember the coffee family. So in a small dose, it's a stimulant. In large doses, it's a relaxant. But we actually really want to, we encourage people to stay at the low doses. At higher doses, it produces a little bit more sedation, relaxation, a little bit of euphoria. The level of euphoria is, people talk about hallucinations, and it's kind of like the reefer madness about kratom. Obviously nobody's ever taken it. It's kind of like the first time if you ever smoked weed and you were like, what is everybody talking about? What's this big thing I'm supposed to experience? I mean, most people all of a sudden will realize, oh, I've got a little bit more energy, or I'm a little bit more I have a little bit more pain, or and I'll talk about this as the effect on depression and anxiety. The really nice thing about kratom is that it has a built-in mechanism for overdose. If you take too much of it, you will get nauseous and throw up. So there has been no documented cases, 0 documented cases of overdosing on kratom. And they're talking about these deaths. The FDA is pulling out these deaths that have supposedly happened with people who are on a whole lot of drugs that also happen to have kratom in their system. And they are also taking, who knows, 10 or 15 other drugs, or maybe even 2 or other drugs. So, but there's been no documented cases to date. And it's been around, and it's been studied for a really long time. It's become recently popular in the last 4 or 5 years in the US, but it's been used for centuries in Thailand and in Southeast Asia. So it's the process of when you sell it as a legal high and you get a profit motive in there, that's where we start running into problems. And I don't know if any of you are old enough to remember ephedra, but ephedra is this wonderful herb that, some people misused it in these really weird doses in these really weird circumstances, and there was a couple of deaths from, high abuse of it, and then they made the whole herb illegal, which is really just, a total shame, because the herb as a plant is wonderful. It's one of the better things for asthma and that there is. There's a little bit of history here. It's interesting. I do think it was interesting that it was made illegal in the 40s because in Thailand because it interfered with the opium trade. But now they're actually, and the other thing I heard that I thought was interesting in Thailand is that the Thai women say they like their men to take kratom because they work, and they don't like them to smoke weed because they sit around. So it's used for arthritis and joint pain. It is the reason why I'm standing here today. I don't take it every day. I didn't take it today, but one of the things you have to be careful of with it, and I'll go into that here in a minute, is it's so effective for pain you can overdo it. So that's one of the reasons why I don't take it every day, is because if I'm out of pain and I'm doing too much, then I'll kind of pay for it later. And that's particularly true with people with back pain or muscle spasms. I've given people kratom. They're out of pain. They run around and they do a bunch of heavy lifting or heavy stuff. And pain teaches us something. We are in pain for a reason. So you have to kind of balance those things out. For people with fibromyalgia, it changes their life. It is phenomenal. If you are interested in going to the American Kratom Association website, the number of stories that you hear over and over and over again of people who have fibromyalgia, chronic pain issues, this horrible story from medical stuff, this horrible story, lifetime of horrible pain, and this has made a huge difference. And trauma or injury recovery, of course, that I know about that. Migraines, I found with my experience with migraines, sometimes it works great for people with migraines, sometimes it doesn't. So I haven't seen it absolutely work for everybody with migraines, but it's certainly one tool in my toolkit. ADHD and work productivity, it really is very effective for that. And depression, chronic fatigue, I can't, again, this is just one of those herbs that really make a difference. And I've just seen it over and over that not only people, if I have a practice, I have friends that come and they buy kratom from me and they tell me about their health issues, and I oftentimes I give them stuff more than I sell them stuff, but I try to sell them stuff if I can. And over, this connection between chronic pain and depression, over and over, is what I see. And these are the things that I find that are super effective is these herbs. So it's legal right now in all but 5 states. They're trying to make it illegal, but again, this is something we all have to be aware of, because if the government can make a plant illegal that nobody's died from, and they have so little proof. They have years and years and years of research. They've been studying kratom scientifically for over 40 years. There's some references in your. I didn't get it together to put together a catalog about my herbal product business, which I should have. It was on my list of things to do, but the printer ran out of ink, so you don't have that, but you have the website. But I did manage to get the references. I wanted everybody to have some of those references on that kratom thing, because there's really some really great research that's been done. And I actually am a fan of evidence-based medicine. I'm also a fan of ancestral and anecdotal knowledge, and sometimes those two things don't always mix. But I think that research and evidence gives us information, and information is power. So I talked about the consumer fight back. It is on the watch list. And so, it is something that you have to be aware of. And I really recommend that people get it from a vendor online that you respect, or and get it straight from Indonesia, and try to avoid capsules or anything adulterated, or that could be adulterated. So it's pretty safe. I've talked a little bit about that. Here was an interesting, 70% of adult males in Thailand take it. I think it's in an energy drink in that region of the world. So it's pretty common. Once in a while it doesn't agree with somebody, and they'll get nauseous from it. And even a small amount. Oh, did you have a question, Plato?
I did, real fast. So I've been taking kratom for a long time. It is in energy drinks in Thailand, somebody used to live there. But I've been taking it for a long time in the drinks and tea.
Uh-huh.
It's nasty. So we've been thinking about moving to the pills. I wondered if you were going to cover the best way to ingest it. I've been very curious on that.
Yep,
Okay.
that's coming up. I think that might be the next one. So we don't recommend it in pregnancy and nursing, because we haven't studied it, and who wants to study it in pregnancy and nursing? Maybe somebody wants to do it to pregnant mice, but why? So just avoid it in pregnancy is the easiest thing to do. The thing that is tricky is that we don't know how it works with other drugs. And remember, I said that there has been a number of deaths, and people are on all these all these different kinds of drugs. So if you do take prescription medications, there's way too many of them. They're not going to study the use of kratom in them. So you just have to, that's a risk that you're taking, and it's a choice that you have to make. And it may depend on the intensity of the drug, or what it is, and how you take it, and what the dose is, and all of those things. So some side effects. I really recommend that people, and I'll explain another side effect here in the next slide, is people take less than 10 grams a day. 5 to 7 is, I think, a really good dose. Some people need to go up to 10 a couple of times a week. There are some people that really need to take it every day because they took opiates every day, or they take antidepressants every day, or it makes such a difference in their life. And I just really wish it grew around here, and then it would solve a lot of our problems. So the worst side effects, and this is not, I haven't really seen this, and the Kratom Association, who are doing a lot of research right now, is not seeing these kinds of problems. This is coming from a long-term study that was done in the 40s of kratom users in Thailand who were chewing the fresh leaves in their laborers. So it's a really big deal for the laborers. They go out and they grab the leaves and they chew them, and they work in the fields. So these guys turned a little bit darker their skin. That was the worst thing, is that their skin got a little bit darker, and they got a little bit of constipation, certainly not the same level of constipation that you get with opioids. And there is some reported sexual side effects for men. It's not been a common one, but then some men want to have that particular side effect. So the next question is kratom addicting, which is the side effect that I want to talk about? Yes, it is addicting. It is as addicting as coffee, which is to say, very addicting. Just, no bones about it. You take it, you will get addicted to it the same as you would if you drink coffee every day. If you drink coffee every day and all of a sudden you stop taking coffee, you're going to feel lethargic, you're going to have a headache, you're going to be miserable for, depending on how much coffee you drink, you're going to, you may be miserable for a little while. It's the same thing with kratom. And it's not the same, some of the things that they'll say out in the, in the blogosphere or whatever is that people have the same withdrawal symptoms as they do from heroin. It's not true. And, again, there's some really good evidence. And once we get these, by the way, this wonderful website and all these materials that we're going to have online is going to happen after the first of the year. I still have the holiday market that I need to make products for and sell products for. We're a very small organization. You're looking at the person who's going to put all those things up online. So be patient with me, folks. We will get there. And I'm going to have a whole section on there on just kratom and all of the research, and we're going to have a little forum where people can talk and share resources. It's going to be great. It's I just realized that I looked at this slide and realized some of my English is bad. Risks of daily use include constipation and it can be expensive. Those should be two different things. The price of it has been getting a little bit cheaper. It is not, if you buy it in bulk in the big jars, it's really not as expensive as a lot of the supplements that people take. And it's certainly, I think it's within the accessibility range. If people stay away from head shop kratom, small doses, they can get them, in a bigger quantity. An average price is anywhere from $5 to $20 an ounce, and a typical dose is 5 grams. So you can do the math on that. So what are the different types? I always say that there's it's usually where it's from and what color the leaf vein is. So some types vary, and there's some kind of general rules of thumb. Oh, I'm running out of time. Is the red veins are usually more sedating, the white veins are more stimulating, and the green veins last the longest. And Meng Da is also called pimp grade. It's a grade. It's the highest grade or the strongest. I think it's a little bit of a marketing thing. And I always tell people that for the types of kratom, it's like strains of weed. It's like, people are into the green Malay as opposed to the white Sumatra, and there's all kinds of different ones. And it's kind of cool because it's a plant. And when it grows differently and it's harvested differently, you're going to get some different results. So even with the Meng Da, so some people have their favorite strain that they stick with. I tend to tell people to mix it up, to not buy a kilo of any one thing, to buy it in smaller doses and mix it up a little bit.
So, just a question I know you said it's marketing, but what do they mean strongest? Like more stimulating, more?
Well, you take the least amount, and it has the most euphoric qualities or the stronger qualities. I haven't necessarily found that to be true, but I found personally that the whites really were overstimulating for me, so I personally don't like whites. But other people really, those are the only ones that work for them. So this is where we were getting into answering Plato's questions. This is the dosage. I guess it's the next slide. That's the preparation. I always tell people start with a lower dose. So 5 to 7 grams. Sometimes 5 grams won't affect somebody and they won't have any results. So sometimes you need 7. So a heaping teaspoon is about right. I really don't. 16 to 20 grams is really high dose. I was even tempted to not even put that on there. I think that's a ridiculously high dose for somebody who would be taking, lots and lots and lots. I really think that really you can get away with 5 to 7 grams once or even twice a day. My chronic pain folks that have fibromyalgia do 7 grams twice a day, and that works for them. So the preparation, you do sort of get used to the taste. Yes, it still tastes terrible, but here's how the best, most effective way to prepare it is I prefer the powder as opposed to the pills. You take a teaspoon of the powder, a heaping teaspoon of powder, put it in a little bit of hot water. I take a little glass and put this much hot water in it, just enough to dissolve it, and then add grapefruit juice. If you can tolerate grapefruit juice is one of those things that really help it synthesize it. And or you can do anything with citrus acid, cranberry, whatever you've got, or if you can't find anything else, a thing of emergency has got citric acid in it. So if you add the citric acid, you add a juice to it, and you keep it in a kind of a small amount, like I do, about that much, then I can sort of drink it down in one swallow, and I'm used to it, and it's fine. Except for I do like a cup of coffee and a kratom, and I have been known to put my grapefruit juice in my coffee, the cream, and the kratom. So you got to be careful about that one.
Daphne,
Yeah.
the grapefruit juice doesn't affect the efficacy of it?
No, it actually boosts it.
Okay.
So grapefruit juice does affect the efficacy of certain drugs and certain other herbs, which is quite kind of interesting that it actually boosts the effectiveness of kratom.
Well, it does that with a lot of drugs. It affects the cytochrome P50
Right.
that all the drugs are.
Yes, but it does
So
it
upregulates.
yeah.
the-
So ashwagandha is one of the herbs that help potentiate it. So I use that when I have my formulas. Oh, you also want to take it on an empty stomach. Some people also take it with ginger if they get the nauseous, but it's going to be much more effective if you take it on an empty stomach. And then also another potentiator, I don't know if I'm saying that right, is black cumin seed oil.
Do you use like one or the other, like grapefruit juice and then black cumin seed oil?
Oh, black cumin seed oil is usually taken in a supplement. You usually wouldn't take it in an actual oil. It comes in like little capsules like vitamin E.
So you wouldn't want to use like all 3 potentiators?
You could. No, you could.
Okay.
Yeah. Well, in order to take the kratom that doesn't taste terrible, you need to mix it with juice. So I'm almost out of time here, and I'm really trying to be sensitive to not take over my time. But I do want to say that one of the things about herbs and herbal pain relief is that we have to remember that herbs are one thing. It's like a drug. It is not going to be effective by itself. Kratom is one herb. Yeah, it's a great herb. Or weed, or the great little herbal formula that you're going to come up with, or, that's just one thing. What's so important, what you need to do is get back to that holistic, physical, mental, spiritual, emotional. You really have, and especially with your chronic pain folks, you really have to address every single one of those, because you're not going to get the same results if you focus on this magic pill. Whether the magic pill grows in the ground or comes from the drugstore, you need to do a full approach, which is the topical applications are an equally important part of it. And part of an important thing about a topical application is that you rub it in that area, which stimulates circulation to that area. So that's an important, somebody can't go to get a massage every day, particularly if they can't afford it. But they can, like when I sell a lot of my old green relief, and I tell people, you really need to massage that in really well. It's going to work more effective. And that's because part of it is all the herbs that are in it, but part of it is the actual physically, putting it on there.
I'm going to take this moment to have a little commercial. I'm a common user of green relief. I have to have another thing. Let's try it out.
Yeah, that's one of it. I did bring some of the stuff to sell because I usually do the holiday market this weekend, and we didn't do it this weekend because we had to reschedule. So I brought some stuff, and I can sell some of my stuff. But anyway, I want to get through this so we can get to the next session here. Any of the things that are mindfulness, relaxation, biofeedback, there's all kinds of breathing, hypnosis, all of those things are super important. I have spent most of my career as a midwife. One of the things that I do in midwifery more than anything else is work with women and their endorphins. And a very typical thing that happens when women are in labor is that things interfere with their endorphin production and they're not able to deal with the pain of childbirth, which ends up setting off a cascade of interventions. Whereas if we work with their natural bodies, our bodies produce endorphins. Our bodies produce the pain relief that we need often. But we need to be able to use all of these tools. The herbs are one thing, physical, the physical stuff is another, but the mental, spiritual stuff is another one. And anything that releases endorphins, singing, music, laughter. They did a study where they showed two groups of volunteers. They took their blood, showed one group a funny movie and one group a boring movie. In 1 hour, there were appreciable differences in white blood cell counts and other things from the funny movie people. It will change people. So I tell people if they're depressed, if they're in pain, fine, pick up the remote, but put it on something funny. If all you can do is watch TV, watch something funny. Distractions, that's, on TV, I think distractions are a perfectly fine way to deal with pain, and that's, however whatever kinds of distractions work for somebody. Another important thing is social interactions, and we're going to get that with chronic pain, and I think that we talked about this a little bit in some of these workshops, is how important community is, how important it is to integrate with people, how easy it is to be miserable and in pain and sitting by yourself. How much pain are you really in, and how miserable are you if you go into you go to a potluck and everybody's laughing and telling funny stories, or you go to church if you go to church, or you do it, whatever it is that you do on a social level is going to make a difference. And then there's the physical therapies, and there's all kinds of them. They're great. I'm not going to go into all of those things, and then I just can't say enough about hydrotherapy. And that's one of the things that I think is really underutilized in pain relief. I mean, if I was going to say something about herbs in pain, I would say herbs and hydrotherapy. Because those are the really, cold water, hot water, baths, all of those things are going to make a really big difference in terms of management of pain, and it's just underutilized. And if you look back, at the old medical stuff from 100 years ago, what were they doing a lot for their medicines as they were using hydrotherapies in all kinds of different ways?
What are TENS?
Oh, TENS units are those little electrical things that you put, there's, what I'm talking about, those little units that you stick in there. People have good results from those. It's electrical nerve stimulation, yeah. Of course, acupuncture, acupressure, all of those things. Acupuncture has been, 3,000 years of experience of using it for pain. So, it's really got a very, very important tradition. And any kind of massage or touch therapy at all, even if it's not going to a massage therapist, having any kind of physical touch, and that can extend into, touch increases our oxytocin. And our oxytocin is part of our, there's a brain chemical soup that happens. And we understand very little of it. We understand dopamines and endorphins and, a few things that we've been able to chemically, figure out. But there's so much more. There's so much more of a mystery. And the more we find out, everything is so integrated with each other. We are able to The human body has this incredible homeostatic mechanism. Like now we're learning all about the microbiome and how all these bacteria that that we were supposed to be born with, that the hospitals washed off of us, but was our seed for growing all the good stuff we need to be healthy. We learned all of these things that the body normally will do. And so one of the things that we need to go back to when we're looking at treating chronic pain, depression, any kind of chronic health conditions is what is the body normally going to do? The nice thing about herbs is that herbs help the body normally do what it does. And so any of these things that that we can do to increase what our bodies normally would do, and oxytocin, you all have seen it's the love hormone. You get it from hugging. You can also get it from pets. That's one of the reasons why people say that, having a pet or petting a pet can be helpful for stress or depression or pain. And that is one of the things. So you can buy all the herbs you want from me or anybody else, but you're not going to get a successful result unless you use all of these other methods, combination. And since I have 5 minutes, I'll give you my 5-minute depression thing. So successful pain management reduces stress or anxiety, improves activity level and functional capacity, and is itself therapeutic and gives control and power back to the individual. So I'm going to do I have 5 minutes, so I'm going to do my little 5-minute thing on depression, which kind of goes along with this, because I think that there's such a correlation between depression and mood disorders and chronic pain. And it goes back to some of these things that we were talking about. So I like to tell people who are depressed, do some research on natural treatments for depression. And what are you going to come up with? You're going to come up with quite a few things. You're going to come up with some of these things that we talked about. Socialization, exercise. Oh, I didn't have exercise on here. I wonder why. But exercise is a super important thing for chronic pain relief, and it's also an important part of depression. It's just really critical. We were born to move, and the fact that we don't is a good part of our problems. So exercise, movement, I'm going to say mindfulness, and that's going to cover all of those things. Spiritual connections, singing, music, oxytocin, sex, orgasms. There's all kinds of things there's lots and lots of research of all of these things that naturally help people with depression. Gardening, getting your hands in the dirt, volunteering. If you just Google natural treatments for depression, you'll come up with 100 websites. Find 10 of them that will work for you. Because not all of them are going to, maybe you're not an exercise person, or maybe you're not a church person, or maybe singing isn't your thing. But find 10 of them, 10 things. I'm not going to do 10 of them a day. I don't know about any of them, but I'm going to try. I know what my 10 things are. But here's what I'm going to try to do. I'm going to try to do 5 of those 10 things a day. So I'm going to try to give myself a hand. So if I'm down, if I'm in pain, if I'm depressed, what have I done today? Have I hugged somebody? Have I sung? Have I danced? Have I, done, taken my herbs or taken good care of my, my nutrition? Have I been out in the garden? Whatever my 10 things are, I can manage 5 of them a day. And whenever I get down, I think, give myself a hand. So that's my 5-minute depression thing is give yourself a hand, think of 10 things. So I sit down with my folks that come to me and talk about and figure out what their 10 things are. And then encourage them do their 5 things. And one of those things is herbs. Just one of those 10 things is herbs. So now I'm open to questions. But I got through it, amazingly enough. I didn't get too distracted, and I got my 5 minutes in.
Oh, a couple questions. One of them, maybe an easier one, or less complicated. Just one is just about sourcing of kratom. There's a lot of. So I know that there are issues with adulteration, and so finding that source, and I was talking with other practitioners through the Herbal Guild and everything, and nobody has any really good sources that they have some that they've tried, but we know that it's not,
You
spiked
can,
with
yeah,
drugs and antibiotics or whatever, heavy metals, et cetera, et cetera. I haven't been able to find one yet.
yeah. You can get them tested. There are a few vendors that do testing. You can get them directly from Indonesia. I get a lot of my stuff directly from Indonesia, but you never know. Also, sometimes just because it's coming directly from Indonesia doesn't necessarily mean that is pure. So you just have to work with somebody whom you trust. There's a lot of there's American Kratom Association has a kind of a vetting process that they'll do for vendors. So I'm not really set up on my website to do a whole lot of orders for it, but I do have people that come locally and I will ship, but I'm not really set up as a big volume thing.
Okay. Thank you.
Another question, but from the back.
So with kratom, with people that are addicted to opiates, just like ones that they get from doctors, the standard ones, what do you do about compliance and switching them over?
So one of the things that I found to be really amazing is well, for one thing, if somebody's addicted, that's a whole issue. That's an addiction issue, and there's not going to be a simple solution to that, or I would be over my pizza addiction. So I mean, there are like people with addictive things, but there's also people who started on pain pills from being in chronic pain, who want to get off of the opiates, who are on prescription opiates that don't necessarily have an addictive personality, that wouldn't be going out and robbing drugstores if they couldn't get their fix. And I find most of my clients that are my regular people that I see have completely gotten off of opiates. So much so that one of the drug treatment counselors in one of the groups came to me and said, "Oh, this is one of my clients told me about this. This is great. I have chronic pain," and started using it herself. So one of the things that I find is it is incredibly effective for people to get them off of opiates, more so than anything else, more so than my other herbal stuff.
How does that transition?
Well, generally you kind of taper it down, and then so sometimes when I like to tell people, if I could grow it in my backyard, I'd say take it every day. It doesn't matter if you get addicted. The fact that the FDA is almost going to outlaw it makes me really nervous. And I'm still going to be able to get it, which is one of the reasons why. And I have and it's just I haven't run into this as much with other people. This is a very weird side effect that I just happen to have with it, where it interferes with my talking and my communication. So I don't take it on teaching days because sometimes I forget things more, or it's kind of an aphasia thing. And it may be because I had a prior brain injury. It just seems to aggravate my prior brain injury. So, but not I'm the only person that I know that has had that result from it. Most people don't. So was there other questions?
Just a spoiler alert, I read in today's Herbal News, which I get every week, that the FDA starts to reject shipments of kratom independent of the legal situation. So maybe it's time to stock up. That's my message.
Yeah, that's it. Yes, that is a good.
The Fedra, that is how they did it with
Yeah.
the Fedra.
Yeah, they started like that.
Yeah. Erin?
I just wanted to mention also that I know somebody personally who had a problem like with kratom, being addicted to kratom, and it really negatively impacted his life. And so I kind of just want to put out there, like, you've been saying, yeah, it's addictive, all this stuff, but just like, it might not be for everybody. Like he had a real struggle getting off of it, and it was a big deal for him.
That's a really good point, and I do want to point that out. If somebody has an addictive personality, and they're the kind of person that, one sign of addiction is that you persist despite adverse consequences. So if you take it every day and you can afford it and it's not causing you any health problems, great, you're not really addicted. But if all of a sudden you have to, be selling things to pay for it, or you need increasing dosages and it's causing you problems, then it's more of something of concern. There are people who have taken it and have, taken increasingly high doses and have gone to the extracts and gone to the pills and, spend a lot of money on it, and their tolerance goes way up and they become addicted like anything else. And then the process of withdrawal is like having the flu when you get off of it. So that is not to say that some people don't have a negative result. That is true. That's a really good point. Anything else? All right. Well, I want to try to have people have a little bit of a break so we're going to be running a little bit behind, but hopefully not too bad.